Hello, and welcome to this training session on behavioral health and emotional support. Today, we'll explore what nursing home staff need to know to provide compassionate, effective care for residents. Your role is vital in ensuring their safety, dignity, and quality of life. These educational resources are supported by a HRSA grant to UND Dakota Geriatrics, a geriatric workforce enhancement program. Today's session will cover how behavioral health care is essential for the overall well-being of residents, how emotional support is a key part of elder care, and how depression is often overlooked in older adults. Behavioral health includes emotional, psychological, and social well-being. In nursing homes, residents may face loneliness, loss of independence, and grief, all of which can affect their mental health. It's important for staff to recognize that emotional support is just as vital as physical care. Depression in older adults may look different than in younger people. Instead of sadness, they may show signs like withdrawal, irritability, sleep problems, or loss of appetite. It's not a normal part of aging, and it should never be ignored. Staff should be trained to notice these signs and report them to the appropriate healthcare professionals. Bereavement is a significant emotional challenge for many older adults. The loss of a spouse or close friend can lead to deep sadness, loneliness, and even physical symptoms. It's important to distinguish between normal grief and clinical depression. Staff should be observant and provide emotional support, encourage social interaction, and notify clinical staff if symptoms persist. Bereavement in nursing homes is a deeply important issue that affects residents, families, and staff alike. Here are some key insights. Bereavement in this setting is not limited to the loss of life. Residents often grieve loss of independence, home, pets, community, and familiar routines, death of fellow residents or loved ones, declining health or cognitive function. Grief can manifest as depression, anxiety, withdrawal, confusion, or even physical symptoms. Let's take a look at best practices for bereavement care in nursing homes. First, resident support. We need to normalize grief as a natural response to loss. Memorials like memory boards or candlelight vigils can help residents process their emotions. Encourage them to express grief through art, music, or group discussions, and involve them in planning remembrance activities. Next, family engagement. Open communication is key, especially during end-of-life care. Offer grief resources like counseling or support groups, and invite families to participate in memorials or legacy projects to honor their loved ones. Now, staff support. Staff members also experience grief, especially after the loss of long-term residents. Acknowledge this, provide debriefing sessions, and promote self-care through peer support and wellness programs. Finally, system-level strategies. Advanced care planning helps residents express their wishes early. Grief training builds staff confidence, and clear bereavement policies ensure consistent, compassionate care. Nursing home staff play a key role in supporting residents' emotional health. This includes building trusting relationships, encouraging social interaction, and creating a positive environment. Staff should also help residents stay engaged in activities they enjoy and feel comfortable expressing their feelings. Let's talk about how we can effectively communicate with and support residents in nursing homes. First, it starts with building trust. Residents need to feel that the people caring for them are consistent, compassionate, and genuinely invested in their well-being. Trust is the foundation of psychological safety. Next, we must listen actively. That means giving residents our full attention, making eye contact, and responding in ways that show we understand and care. When we validate their feelings, we let them know it's okay to express emotions, whether it's joy, sadness, or frustration. Speaking clearly and calmly is also essential. Many residents may have hearing difficulties or cognitive impairments, so using a gentle tone and simple language helps reduce confusion and anxiety. We should also provide reassurance. A calm presence and kind words can go a long way in helping residents feel safe and supported, especially during moments of distress or uncertainty. Encouraging participation in meaningful activities, like music, art, or group discussions, can boost mood and reduce feelings of isolation. These activities help residents stay engaged and connected. Finally, remember that you're not alone. Collaborate with mental health professionals when needed. Social workers, counselors, and psychologists can offer additional support and guidance for both residents and staff. Together, these strategies help create a nurturing environment where residents feel heard, respected, and emotionally supported. Behavioral health is a vital part of overall care in nursing homes. By understanding depression and providing emotional support, staff can greatly improve residents' quality of life. Thank you for your commitment to compassionate care.